There are 6 government and industry programs sitting right now attached to your Medicare card that can cut, cap, or completely eliminate what you pay for prescriptions every single month. 6 programs, not 1 6. And before I go one sentence further, I have to clear up the single biggest misunderstanding about this topic, because it's the exact reason most people who legally qualify never file a single form for any of them. Well, almost none of these programs require you to be poor. 2 of them apply to you automatically right now, whether you're barely getting by or perfectly comfortable. The rest just require you to ask. Well, some of you are thinking, I'm comfortable, I have savings, this isn't for me, you're wrong. And here's exactly why 2 of the 6 programs in this video, the annual cap on what you pay for covered drugs and the monthly cap on insulin, apply to every single person with Medicare Part D. Full stop. Your income has nothing to do with it. This is not a poverty program. This is a working and retired middle income program. And a comfortable one too. Some of you are thinking, I already have a Medicare Advantage plan, so I'm covered. You're still wrong. These caps apply to Medicare Advantage drug coverage exactly the same way they apply to a standalone Part D plan. Some of you are under 65. Maybe you're on Medicare because of a disability, not because of your birthday. You've spent years assuming these programs skip you because you're not a senior yet. They don't. Extra Help and the Medicare Savings programs go by Medicare enrollment, not by age. Some of you tried something like this years ago, got a denial letter, and never looked again. The rules changed substantially in 2024. What disqualified you then may not disqualify you now, and some of you own your home outright, have no mortgage, and a little tucked away in savings. And you assume that automatically disqualifies you. For most of tonight's list, your home doesn't count against you at all, and the actual dollar lines are higher than most people guess. So this is for every one of you. Let me make this as concrete as I can. Before 2025, a Medicare beneficiary on an expensive specialty drug for cancer, rheumatoid arthritis, or a rare condition could pay tens of thousands of dollars a year in Part D costs, with no ceiling at all. Today, that same person's cost for covered drugs is capped for the entire year, and if they don't know that cap exists, or don't know about the option to spread it out monthly, they can still feel that number as a gut punch every January. A single senior in Pennsylvania earning around $20,000 a year, paying close to full price for 8 prescriptions a month, can drop those to single-digit and low double-digit copays through a state program most of her neighbors have never heard of. We'll run that gap out 10 years, and you are looking at a 5-figure difference in what one person pays for the exact same medications in the exact same pharmacy on the exact same street. There is real money on this list with your name already on it, so why has nobody told you? Not your doctor, not your pharmacist, not the company that mails your Part D premium bill. Here's the actual mechanism, not a conspiracy. Every one of these 6 programs requires an affirmative application. Somebody has to fill out a form, and the agency or company that would spend less money if you filed that form has zero financial incentive to make sure you know it exists. The Social Security Administration doesn't call you on your 65th birthday and read you the Extra Help income limits. Your state Medicaid office doesn't mail you a Medicare Savings Program application the week you go on a fixed income. And here's the part that should genuinely frustrate you. Pharmaceutical companies that sponsor patient assistance programs operate under federal rules that keep that charity separate from your Part D benefit, specifically so it can't be used as a marketing tool at the pharmacy counter, which also means almost nobody behind that counter is going to casually mention it to you. Your pharmacist could mention some of this. Your tax preparer could mention some of this. The company that already has your income on file for other reasons never will. None of them are hiding anything from you out of malice. They simply have no line item in their budget for tracking you down and telling you. That is the entire reason 6 programs worth real money sit unclaimed while people quietly ration pills to make a bottle last another week. What I do on this channel is take the parts of the Medicare and benefits system that are written in language built to be skimmed past and translate them into something you can actually act on this week. Here's what's ahead, 6 items, in order from the one almost every low to moderate income senior should check first, to one that, as far as I can tell, gets almost no coverage anywhere else online. Item 1 is the federal program that can wipe out your Part D premium, deductible, and copays down to a few dollars a prescription. Item 2 is the companion state-run program that can go even further, and often gets triggered by that very same paperwork. Item 3 is a set of protections that already apply to you right now, whether you've filed anything or not, and most people only know half of what it actually covers. Item 4 is a payment option almost nobody mentions, one that turns a painful lump sum pharmacy bill into a manageable monthly one. Item 5 is a state-specific benefit some of you have access to today, with an income ceiling that just changed dramatically this year. And item 6 is the one I went digging for specifically, a resource for brand name drugs that has nothing to do with your Medicare eligibility, or your state, or your income bracket at all. Being legally entitled to lower prescription costs and actually paying lower prescription costs are two completely different things. The law does not refund you automatically. Nobody mails you a check out of kindness. You have to know the form exists, and you have to be the one who fills it out. Item 1 is Extra Help, also called the Part D Low Income Subsidy, or ILIS. Here's exactly what it does. It can pay your Medicare Part D premium up to your region's benchmark amount, wipe out your annual deductible completely, and cap what you pay per prescription at just a few dollars, roughly $5 for a generic and around $13 for a brand name drug under the 2026 amounts. Who qualifies? This is a federal program. So the rule is the same everywhere, income at or below about 150% of the federal poverty line. For 2026, that works out to somewhere just under $24,000 a year for a single person, and around $32,000 for a married couple living together. Those exact numbers adjust every January, so confirm the current figure when you apply. There's also a resource or asset. We'll test roughly $16,000 to $18,000 for a single person and $33,000 to $36,000 for a couple, depending on whether you've set money aside for burial expenses. Your home and one vehicle are not counted at all. And here's the number that should make this land. The Social Security Administration's own estimate is that Extra Help is worth about $5,300 a year per person for people who qualify and don't already have it, exactly where it lives. This is filed with the Social Security Administration using Form SA-1020, Application for Extra Help with Medicare Prescription Drug Plan Costs. How to actually get it? Go to SF Medicare Part Extra Help and apply online, or call Social Security directly at 1-800-772-1213 and say, I'd like to apply for Extra Help with my Medicare prescription drug costs. You can also walk into your local Social Security office and ask for the same thing in person. There's no cost to apply and no penalty if it turns out you don't qualify. The most common way people lose this one: applying before their Medicare Part A and Part B enrollment is actually active, or leaving sections of the form blank instead of writing none. Both of those are two of the most frequent reasons applications get delayed or denied. Not true ineligibility, just an incomplete file. Answer every question on that form, even if the answer is 0. One more thing this single form does: filing it automatically forwards your information to your state Medicaid agency to screen you for the next program on this list, unless you specifically tell Social Security not to. Which brings us to Item 2. Item 2 is the Medicare Savings Program's 3 tiers known as QMB, SLMB, and QI. Here's exactly what they do. QMB, the most comprehensive tier, pays your Medicare Part B premium plus your Part A and Part B deductibles and coinsurance. LMB and QI, the next 2 tiers, pay your Part B premium only. And here's the part that surprises people: getting approved for any Medicare savings program automatically enrolls you in full Extra Help too, with no separate application required. Who qualifies? This program is run state by state, so the exact dollar lines shift depending on where you live, and several states, Connecticut, Delaware, Louisiana, Maine, and Mississippi among them, don't apply an asset test at all. To make this concrete, here's one real verified example. In New Jersey for 2026, LMB covers a single person earning up to $19,152 a year, or a married couple up to $25,968. And QI covers a single person up to $21,546, or a couple up to $29,214, both with asset limits of $9,950 single and $14,910 married. Your own state's numbers will differ somewhat, but the shape of the program is the same nationwide. The real dollar impact. The standard Part B premium alone is a real recurring monthly bill. And QMB on top of that wipes out deductibles and coinsurance you'd otherwise pay every time you see a doctor or fill a prescription that crosses into Part B territory, exactly where it lives. Your state Medicaid agency, not the Social Security Administration, and not Medicare directly. How to actually get it? Call your state Medicaid office and say, I'd like to apply for a Medicare savings program. Can you tell me whether my income qualifies me for QMB, SLMB, or QI? If you've already filed Form SA-1020 for Extra Help, ask whether that referral has reached your state yet before starting a second application from scratch. The most common way people lose this one: assuming a Medicare savings program is the same thing as full Medicaid, and skipping the application because they think their income is too high for Medicaid. It isn't the same test. Many people who don't qualify for full Medicaid still qualify for one of these 3 tiers. Well, here's the part where a lot of comfortable retirees mentally check out and where you really shouldn't, because the next two protections on this list apply to you no matter what your income is. Item 3 is a pair of protections created under the Inflation Reduction Act, the annual out-of-pocket cap on Part D drugs, and the monthly cap on insulin. Here's exactly what they do. Once your true out-of-pocket spending on covered Part D drugs hits $2,100 in a calendar year, your plan pays 100% of your covered drug costs for the rest of that year, separately. Insulin covered under Part D is capped at 35 for a month's supply, no matter what stage of coverage you're in, and you don't have to meet your deductible first to get that price. Who qualifies everyone. If you're enrolled in a Medicare Part D plan or a Medicare Advantage plan that includes drug coverage, this already applies to you. No income test, no application. The real dollar impact, and here's the number that should make this land. Before 2025, there was no ceiling at all on Part D out-of-pocket costs. Someone on an expensive specialty medication could pay tens of thousands of dollars in a single year with no limit in sight. Today, the most anyone pays for covered drugs is $2,100 for the entire year. And the maximum Part D deductible for 2026 is $615, so your total yearly exposure has a hard ceiling under it before you even reach the cap, exactly where it lives, built directly into every Part D and Medicare Advantage prescription drug plan. Administered by your specific plan under CMS rules. How to actually get it. There's nothing to file, it already applies. What you should do is to track your running total. It's printed on the monthly explanation of benefits your Part D plan mails or emails you, so you know exactly where you stand against that 2100 line. The most common way people lose track of this one, assuming every dollar they spend on medication counts toward the cap. It doesn't. Only spending on drugs covered by your specific Part D plan counts. A drug billed under Part B, instead some infused or injectable medications. For instance, is tracked separately, so don't be surprised if your running total doesn't match what you feel like you've spent. And here's the part that most people miss entirely about this cap. Well, you don't have to pay it all up front. Item 4 is the Medicare Prescription Payment Plan, sometimes called M3P or smoothing. Here's exactly what it does. It lets you spread your out-of-pocket Part D drug costs across monthly installments for the rest of the calendar year, instead of paying the full amount at the pharmacy counter the moment you fill an expensive prescription. Who qualifies? Again, anyone enrolled in a Medicare Part D or Medicare Advantage drug plan. No income test here either. The real dollar impact. This doesn't lower what you owe overall, but it converts a $1,000+ pharmacy bill that hits in February into a manageable monthly payment spread out through December, with no interest or fees charged for spreading it out, exactly where it lives. Administered by your individual Part D plan under CMS rules that require every plan to offer it. How to actually get it. Call the member services number on the back of your Part D plan card and say, I'd like to opt into the Medicare Prescription Payment Plan for this year. If you were already enrolled last year and you're staying with the same plan, current rules re-enroll you automatically for 2026, unless you opt out. The most common way people lose this one, switching Part D plans during the fall enrollment period and assuming their payment plan election carries over automatically. It doesn't. If you change plans, you have to opt back in with the new one. Those two protections apply everywhere in the country. The next one only exists if you live in the right state, and if you do. It can be worth more than everything we've covered so far, combined. Item 5 is a State Pharmaceutical Assistance Program, or SPAP. More than 20 states run some version of this. Here's exactly what it does. It wraps around your existing Medicare Part D coverage to lower or eliminate your copays, help close any gaps, and in some cases even cover your Part D premium itself. Let me make this concrete with two real verified examples. In Pennsylvania, the program is called PACE and PACENet, funded by the Pennsylvania Lottery. PACE covers residents 65 and older with income up to $14,500 if single or $17,700 if married, with copays of just $6 for generics and $9 for brand name drugs. PACENet covers a higher income band from $14,501 up to $33,500 single or $17,701 up to $41,500 married, with slightly higher copays of $8 and $15. Well, and here's the part that, as far as I can tell, hasn't made it into most coverage of this topic yet. Under Pennsylvania Senate Bill 731, signed into law in June 2025. That PACENet income ceiling jumps to $45,000 for a single person and $55,000 for a married couple starting July 1, 2026, a substantial expansion that could newly qualify residents who were shut out just last year. In New York, the program is called Epic Elderly Pharmaceutical Insurance Coverage. It covers residents 65 and older with income up to $75,000 if single or $100,000 if married, among the most generous income ceilings of any state program in the country. With copays running 3 to 20 depending on the cost of the drug, and full premium help for people under about 23,000 single or 29,000 married, who qualifies, and the dollar impact. Both programs routinely take prescription costs that would otherwise run into the hundreds of dollars a month down to single-digit or low double-digit copays per prescription, exactly where they live. The Pennsylvania Department of Aging runs PACE and PACEnet. The New York State Department of Health runs Epic. If you live somewhere else, the program in your state will have its own name entirely. How to actually get it in Pennsylvania, call 1-800-225-7223 and say, I'd like to apply for PACE or PACEnet in New York. Call 1-800-332-3742 and say, I'd like to apply for Epic. In any other state, search your state name Pharmaceutical Assistance Program for Seniors and start with the same script. The most common way people lose this one, assuming a decent income automatically disqualifies them. New York's 75,000 and 100,000 ceilings in particular catch people off guard because they assume state help is reserved for the poorest residents in the state. It usually isn't. If you don't live in Pennsylvania or New York, don't tune out. The last item on this list has nothing to do with what state you live in or even what your income is, and it's the one, as far as I can tell, exists in almost no other video on this topic. Item 6 is manufacturer patient assistance programs, most easily searched through a free tool called the Medicine Assistance Tool, sponsored by America's biopharmaceutical research companies, along with the nonprofit directory NeedyMeds. Here's exactly what this does. Individual drug manufacturers give away or deeply discount their own brand name medications directly to patients who can't afford them, operating completely outside your Part D benefit. Who qualifies? This varies program by program and drug by drug, since every manufacturer sets its own rules, but many of these run well above the poverty line. One well-known nonprofit program, RX Outreach, uses a sliding income scale that reaches roughly 2.5 times the federal poverty level, covering more than 500 different generic and brand medications for people solidly in middle-income territory. Not just the poorest applicants, the real dollar impact. For a single expensive brand name drug, this can mean the difference between paying the full retail price out of pocket and paying nothing at all for that medication. And federal rules keep this assistance structured separately from your Part D benefit specifically, so it can help Medicare enrollees without conflicting with your drug plan, exactly where it lives. There's no single federal office running this. Every pharmaceutical company runs its own program, but the Medicine Assistance Tool at Medicine Assistance Tool, org, along with NeedyMeds, org, both work as free search engines across hundreds of these programs at once. How to actually get it? Go to medicineassistancetool.org, type in the exact name of your prescription, and it will show you which manufacturer program, if any, covers that specific drug and what paperwork it requires. Often your prescriber needs to sign the application alongside you, so it helps to bring it up at your next appointment. The most common way people lose this one, assuming that having Medicare automatically excludes them from manufacturer help. It doesn't rule you out. Federal rules do restrict some forms of direct cash assistance to Medicare enrollees, but properly structured drug assistance is specifically allowed to reach Part D enrollees too. Don't assume you're excluded, check the specific drug. So there they are. 6 programs, 6 real names, 6 exact places to call. Item 6, that manufacturer assistance search, is the one most people watching this have genuinely never heard of. Because it doesn't come from a government mailer at all. It comes from the same companies that make the medication in the first place, and they have their own reasons for not shouting about it at the pharmacy counter. Here's the thesis this whole video sits on: being legally entitled to lower prescription costs and actually paying lower prescription costs are two completely different things. The law does not refund you automatically. Nobody mails you a check out of kindness. You have to know the form exists, and you have to be the one who picks up the phone. So here's the one thing to do this week. Pick the single most likely program from this list based on your income and your state, and make one phone call if you're not sure where to start. Call 1-800-772-13 and simply ask about extra help. That one call alone can trigger a look at the Medicare Savings Program too. And if you have a parent, a neighbor, or someone in your life quietly rationing pills right now to make a bottle last longer, send them this video today, not next week. The prescription they're stretching thin is the exact 1/6 different programs exist to cover. One phone call. That's genuinely all it takes to find out what you've already earned.